Welcome to All Home Care Matters, the show where we discuss all things home care, with discussions on important age-related matters and topics. Brought to you by Enriched Life Home Care Services, the #1 rated home care provider in Michigan by Top Rated Local.
Hello, and welcome back to All Home Care Matters. If this is your first time visiting us here at the show, we want to say thank you for taking time out to be with us today. We appreciate how valuable everyone's time is, and that's why we try and make each episode here at All Home Care Matters something that will hopefully matter to you. If your loved one has survived a stroke, you might be worried about a vascular dementia diagnosis. While vascular dementia can be caused by a number of things, a stroke is one of the most common. If your loved one has already been diagnosed with vascular dementia, you might feel overwhelmed and uncertain about the future. Vascular dementia can be a difficult diagnosis for anyone to come to terms with, especially because this type of dementia usually occurs after a stroke or other traumatic brain injury. Families and patients alike are already grappling with so much stress, worry, and heartache from the first incident that the added stress of a dementia diagnosis can feel utterly devastating. While there is no cure for vascular dementia, there are treatment options available that can delay the progression of the disease. Usually, if the dementia is caused by a stroke, then the treatments used to control stroke symptoms will also help to control the dementia. That said, successful treatment depends on an early diagnosis of the disease. So, if your loved one has suffered a stroke, it's that much more important to be on the lookout for signs and symptoms of dementia. That way, you can make sure your loved one is taken to the doctor at the first possible warning signs. On today's episode of All Home Care Matters, it's all about understanding vascular dementia. From the causes and symptoms, to how the disease functions in the brain, to treatment and care tips. And we hope that this episode helps you to feel less daunted and more supported as you move forward on this journey. Vascular dementia is considered the second most common form of dementia worldwide. According to the World Health Organization, there are nearly 10 million new cases of vascular dementia diagnosed around the world each year. And it's estimated that vascular dementia accounts for about 10% of dementia cases worldwide. Even so, the disease is commonly misdiagnosed, confused for Alzheimer's or other cognitive issues or even depression. While a misdiagnosis of Alzheimer's may not make a huge difference in the care your loved one receives, the correct diagnosis will help you to better understand why your loved one is behaving in a certain way, what they might need, and what to expect in the future. While Alzheimer's and vascular dementia are similar, they are not the same disease, and understanding the differences is essential to ensuring your loved one is receiving the best possible care. One of the biggest differences between Alzheimer's and vascular dementia is the cause. Vascular dementia occurs when the blood flow to the brain is interrupted. This can be due to a stroke, a series of mini strokes, or damaged blood vessels. If it occurs after a stroke, it's because the stroke has blocked a brain artery that impairs the blood flow to the brain. Not all strokes cause vascular dementia. Still, even if your loved one has survived a stroke without noticeable symptoms, it is possible for vascular dementia to occur. Caregivers should always keep an eye out for the possible warning signs. When it comes to damaged blood vessels, they could be damaged due to becoming worn with age, high blood pressure, diabetes, brain hemorrhages, or abnormal aging of the blood vessels. The cause of Alzheimer's disease is not fully understood by researchers, although they know that certain factors, such as age or lifestyle, can increase the risk of getting the disease. People at risk for vascular dementia, on the other hand, are those who have diabetes, high blood pressure, high cholesterol, or coronary heart disease. On a cognitive level, there are some key differences between the two diseases. In vascular dementia, cognitive issues might decline quite dramatically in the beginning, usually right after a stroke or a mini stroke, but then stabilize for longer periods of time. When there is a decline, it tends to happen rather quickly and unexpectedly. According to Verywell Health, these changes are often described as step-like, since in between them, brain functioning may hold steady for elongated periods before taking a sudden decline. In Alzheimer's disease, a person's cognitive function will decline steadily over time without long stabilized periods in between. Very Well Health explains that, in contrast to the step like decline in vascular dementia, Alzheimer's is typically more like a slight downward slope of a road over time. There are also physical differences between the two diseases. Because vascular dementia tends to occur after a stroke, a person might suffer from severe physical ailments depending on their reaction to the stroke. Some stroke survivors are unable to move one side of their body, for example. And because of this, those experiencing vascular dementia might face an entire other set of struggles earlier on in the disease. Alzheimer's patients, on the other hand, tend to suffer physical ailments only in the later stages of the disease. These ailments can include problems with swallowing, walking, and balance. Finally, the diseases differ greatly in terms of progression. It's not possible to pinpoint a specific progression timeline for vascular dementia because of a number of varying factors. For one, the level of damage to the brain will impact how quickly or slowly the dementia progresses. The health and lifestyle of a patient can also determine progression. People without other underlying health conditions, for example, tend to progress more slowly. For Alzheimer's patients, the progression of the disease averages around 8.5 years and is a lot more predictable. While every individual case is different, most people follow a similar enough trajectory to make a future with Alzheimer's relatively predictable for patients and their caregivers. Now that we understand the differences between Alzheimer's and vascular dementia, let's get into the symptoms and warning signs of the latter. One reason that vascular dementia is difficult to diagnose is because symptoms vary depending on where in the brain the blood flow is impaired. Still, there is a general list of symptoms that many vascular dementia patients experience. Early symptoms include changes in mood and behavior, usually in the form of apathy, depression, and lack of motivation, trouble concentrating, disorganized thoughts, comprehension struggles, and memory problems. It's important to note that memory problems are slightly rarer in patients with vascular dementia, especially early on. These symptoms could occur immediately after a stroke or in the weeks or months following, so make sure that you continue to watch out for any warning signs throughout the first year following a stroke. The early signs of vascular dementia can be relatively subtle, and if they don't occur immediately after a stroke, they can be easier to miss. Make sure to take your loved one to see a doctor as soon as they show any or all of the early symptoms, even if they don't seem meaningful or like they're interrupting daily life. The earlier a person can receive a diagnosis, the better chance they have of controlling the progression. Many people are not diagnosed with vascular dementia until the later stages of the disease. Because of this, it's essential that you have an understanding of the later symptoms also. Some of these symptoms might happen rather quickly, while others progress slowly over years. As with early symptoms, late symptoms vary depending on what part of the brain is affected. Late symptoms include disorientation and significant confusion, major personality changes such as aggression, which can become violent, language problems, depression, frequent falls and difficulty maintaining balance, incontinence, and slow thinking. If you notice any or all of the early or late stages of vascular dementia in your loved one, arrange an appointment with their doctor as soon as possible. A doctor can evaluate your loved one for vascular dementia, and if they do diagnose the disease, they can work with you and your loved one to create a treatment plan that is best for them. Again, the earlier a diagnosis can be given, the more successful treatment tends to be. Treatment for vascular dementia varies depending on the severity of the disease and the part of the brain that is affected. Most patients will already be seeing doctors regularly, taking medications and following treatment for their stroke, mini stroke, or damaged blood vessels. Still, because the treatment does vary depending on the person, it's important for patients to consult their care team when coming up with a treatment plan. In most cases, doctors will recommend a care plan delaying the dementia's progression. Controlling the disease means stabilizing the symptoms so the progression of the disease is delayed. Treatment is also aimed at reducing the risk factor for further damage to the brain. Reducing risk factors can also help to postpone decline. Everyone with vascular dementia should practice a healthy lifestyle. The National Institute on Aging recommends establishing a safe exercise routine to keep patients active, strong, and motivated. Maintaining a healthy weight is also highly recommended. Not only is exercise an excellent way to stay fit, help with balance, and reduce the risk of a second stroke, it's also a wonderful way to keep your loved one engaged, stimulated, and entertained. Work with your loved one's doctor to find exercises that best fit your loved one's abilities. You can add elements like upbeat music or friendly competitions to keep the exercises entertaining for your loved ones. Exercise is also an excellent way to fight depression, which is one of the most common symptoms in vascular dementia patients. According to the Mayo Clinic, exercise can be just as effective as antidepressants for many patients. That's because when exercise is strengthening the nerve cells in the brain, it improves the connection between cells and relieves depression. In addition to exercise, people with vascular dementia should practice healthy eating. It is recommended that patients eat diets rich with fruits, vegetables, and oily fish. Patients should also avoid eating too much salt and fat. Patients should also refrain from drinking too much alcohol. This is incredibly important for vascular dementia patients for a number of reasons. Not only does alcohol negatively affect the brain and memory, but it can also have a severe impact on mood. And for vascular dementia patients who already struggle to control their behavior, too much alcohol is never a good idea. In addition to limiting alcohol, patients should cut out smoking cigarettes completely if they are smokers. Smoking can increase the risk of another stroke or further damage to the brain. In addition to following a doctor's treatment plan and practicing a healthy lifestyle, patients can also benefit from other forms of support. Because depression and anxiety are such common symptoms in people with vascular dementia, many patients benefit from support groups, counseling services, or therapy. This disease can feel extremely isolating, so having someone to talk to or relate to can make an enormous difference. Speaking of health, if you are caring for someone with vascular dementia, it's essential that you take care of your own mental and physical health as well. Caregiving, while immensely rewarding, can also be incredibly difficult. Many communities offer support groups for family caregivers, as well as for people whose loved ones are suffering from dementia. You can also seek the help of a therapist or a counselor. Remember, the better you care for yourself, the better you can care for the person you love. Listen to our episode on caring for the caregiver to find out more about how you can find the support you need on this journey. Vascular dementia can be a difficult diagnosis to come to terms with. But the more you understand about the disease, the better prepared you can be for what's ahead. We hope that this episode helped you to understand vascular dementia a little bit better, so you can focus on spending time with your loved one and making sure they're getting the best possible care. We want to thank you for joining us here at All Home Care Matters. All Home Care Matters is here for you and to help families as they navigate these long-term care issues. Please visit us at allhomecarematters.com, where there's a private, secure, fillable form where you can give us feedback, show ideas, or if you have questions. Every form is read and responded to. And please, if you know someone who could benefit from this episode, please share it with them. And remember, you can listen to the show on any of your favorite podcast streaming platforms and watch the show on our YouTube channel, and make sure to hit that subscribe button so you'll never miss an episode. Next time on All Home Care Matters, you'll want to join us if you are caring for a loved one, or maybe you are working in the healthcare industry and you don't ever seem to be able to find the time to take care of yourself. We want to help provide you with some tips so that you can better care for yourself. We'll see you next time, and thank you.
Thank you for joining us today. We look forward to you joining us again on another episode of All Home Care Matters. To learn more about the show and to connect with us, visit us at allhomecarematters.com.